So students, we will discuss a surgical material which was very regularly used earlier. Now it is said that should not be used or not commonly used, but many people I have seen they are using it. So what is this material is? See that there is a belt like that. See that wider area here. There is a push here inside. You can see that. So other area of the same thing. So this is hernia truss used in reducible. So word I have put reducible inguinal hernia. If you put into the irreducible inguinal hernia, strangulation can occur or obstruction can occur. Dangerous. Olden days it is used, but not now. Also available in the market. Very commonly used by the patients by purchasing over the counter. But ideally, scientifically, it is said that it should not be used. But in the exam, there's an exam, you tell hernia truss. Olden they were using it, but currently it is not accepted. So measurement is taken from the tip of the trochanter tip to the third sacrum, like that. It's a measurement where it encroaches like this, both sides of the tape. So it can cause complication, discomfort, ulceration, neuritis, strangulation, atrophy. Truss currently is not accepted. Remember, even though very commonly it is used, that's important thing. It is absolutely, even though it is used, suppose many people are using it, at least advise them, don't use it for femoral hernia and inguinal hernia, which is complicated inguinal hernia, not just complicated inguinal hernias like irreducible hernia, obstructed hernia, don't use it. Actually, reducible hernia is, the indication is if at all if you are using reducible inguinal hernia, don't use it in the femoral and complicated hernia. That's the point I want to stress. But ideally, current concept is it should not be. But I have seen many patients are using, especially in this country, because it's available over the counter, still marketed very well. And so answer the MCQ. The SRB repair is done. A type of onlay mesh repair, a tissue-based no mesh repair, preperitoneal mesh repair, laparoscopic mesh repair, Desarda repair. Students, find out and put the answer in the comment box. I'll get back to you. So house shape, another MCQ. House shape Romberg sign is a feature seen in obstructed femoral hernia, Romberg hernia, obturator hernia, Lauger's hernia. Again, find out the answer and put it in the comment box. I will give the right answer later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic. And principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination. Remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos. And it also gives the instruments, specimens, then operative surgery briefly, everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with around total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and have memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My digital lecture through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.